Good evening, guys. Welcome to Kudos MD. I'm your host, Dr. Ta. We are going to talk about a very important topic, which is quite relevant around this time of year. And it is an infectious disease topic, which is the only infectious disease in the top 10 cause of death in the United States. That's right, pneumonia. Let's get right into it. Pneumonia, what is pneumonia? It is an intrinsic infection and inflammation of the lung tissues. So we're not talking about bronchitis, we're talking about pneumonia, which is much more severe and dangerous than bronchitis. The top 10 cause of death in the United States, pneumonia stands at number 7. So it is quite one of the leading cause of admission into the hospital around the United States. And worldwide, it is the number 1 cause of death in children under 5. So very important disease that we need to talk about. And of course, the one that is making worldwide news right now is the coronavirus pneumonia, or the Wuhan pneumonia that everybody's talking about. So we are going to discuss about pneumonia in general in this topic. Now, what are the signs and the symptoms or the presentation of pneumonia? Pneumonia causes cough, we know that, but it can also cause a fever, and to the extent of the severity can cause dyspnea or shortness of breath. Now that can progress into an infection of blood and can cause multi-organ failure and can lead to what we call septic shock or sepsis, which is an infection of blood, and later on can cause failure of further organs like kidneys, for example, and can cause a drop in the blood pressure, which is hypotension. It can cause the people to get confused, and that ultimately can lead to death. So the way that the doctors diagnose pneumonia, physical examination is really not that reliable because a lot of lung diseases can cause similar presentation in the examination of the lungs. The x-rays that are often ordered in the hospital or the clinics or urgent care or even emergency room are the first line of diagnostic tests, and it can show infiltrates inside the lungs. And that's what the pictures of a pneumonia, a true pneumonia, looks like. And you can see the infiltration, which basically mean consolidations, and those are infectious fluid. And they're literally pus. They are containing infectious liquid with white cells in there, and that cause the fluid to accumulate into the lung tissues. And as you can see, at the angle of a lung, that's a normal x-ray. That versus an pneumonia x-ray, you can see what we call blending of the angles, or the fluid in the angle. We can see infiltrate in the x-ray, and that is very typical presentation of pneumonia on chest x-ray. They can diagnose it through a CT scan, but of course the most accurate diagnosis is through biopsy and culture of the lung fluid, which is really not feasible on everybody. So it could be diagnosed through images plus clinical pictures. Now, what are the causes of pneumonia? Unlike bronchitis, the most common cause of pneumonia is actually bacterial, okay? And strep pneumonia is still the most common bacteria that can cause pneumonia, followed by these other bacteria, not in particular order, but these are just a sample of the bacteria that can do that. We can see Klebsiella, we can see Haemophilus, we can see Legionella, which is pretty famous in infected warm water of the heating system or cooling system, for example. The second most common causes are viral, and these are the viruses. And of course, the most famous virus right now is coronavirus. But flu can do it, adenovirus can do it, parainfluenza virus can do it, not just one virus, but literally any virus can cause pneumonia. And the third common cause is what we call fungal infections, which is much less common. It happens more in people who are immunocompromised, and it is just not a very common cause of pneumonia. Now, your doctor will decide whether or not you really need to be admitted to the hospital or not, because 80% of the time, pneumonia can be treated as outpatient. So you don't need to go into the emergency room, and you certainly don't need to be admitted to the hospital. But if you are having pneumonia and the severity is getting worse, if you are having worsening of your pneumonia, and the signs and the symptoms indicate that usually when you have a respiratory rate of above 30, or your doctor can actually measure your blood if you are in a clinical setting. The pH in the blood should be less or equal than 7.35. That means that you're getting more acidotic, or there's more acidic buildup in your blood. Your blood pressure can drop, or the so-called hypotension. That indicate that you are getting a blood infection, and that's why you are dropping your blood. Your pulse or your heart rate should be high in the 125 or above. So we call that tachycardia or elevated heart rate. People can get confused because of this. They get confused because the perfusions into the organs are less, mainly the brain, for example. You can have a fever above 40 degrees or 104 Fahrenheit. Now, if you are 65 or older and you have multiple comorbidities such as CHF, severe asthma, uncontrolled diabetes, cancer, or any type of immunocompromised status like HIV, for example, or autoimmune diseases, COPD exacerbation can absolutely happen when you have a pneumonia. So, and of course, we talk about specific when you get into the emergency room where they check your blood, they check your BUN level, which is a blood urea nitrogen level above 30. Usually the sodium in the blood can drop below 130. Usually your sugar can spike up if you're diabetic. These are all the signs that your doctors will evaluate and stratify and determine whether or not you really need to be admitted to the hospital for IV antibiotics or not. So another important detail that we have to differentiate is community-acquired pneumonia, CAP, versus hospital-acquired pneumonia, HCAP. What is the difference between the two? What is a community-acquired pneumonia versus the hospital? Really is the timeline. The timeline differentiate whether or not you have CAP or HCAP. Community-acquired pneumonia usually happens, of course, in the community. What if you just got into the hospital and you got pneumonia? So let's say you go into the hospital for chest pain and then you got pneumonia a day or two after. Is that considered a hospital acquired or is that considered a community acquired? Well, it turns out if you are in the hospital for less than 48 hours, it is a community acquired pneumonia. But if you've been in the hospital for more than 2 days, 3 days, and then you started to develop pneumonia, that would qualify you to have healthcare acquired pneumonia. So the timeline is important on how to differentiate the different type of pneumonias. And of course, the treatment is antibiotics. Let your doctor choose what kind of antibiotics you need. Every antibiotic is different. The setting is different. You have to take into the account the severity of pneumonia. Is it community acquired versus hospital pneumonia? Do you have other comorbidities? How are your kidneys doing? How's your liver doing? And based on the blood culture and based on the presentation, your doctor will choose different type of antibiotics to treat the pneumonia. And not because a Z-Pak is the most famous drug to treat pneumonia that you're going to ask the Z-Pak. So please make sure that you let your doctor decide what is the best treatment for you. So what can you expect as a patient once you get a diagnosis of pneumonia? It's important to stay home, okay? If you go to work or you go to school and you cough and you spit and you propagate the respiratory droplet, you can certainly infect other people. You do not share food because that's where the droplets come in, okay? Wash your hands frequently because it's unbelievable how many times we touch our mouth and our nose, and then we touch a glass of water, we touch objects, and then other people touch the same objects, the doorknobs, the elevator, and they touch their mouth and their nose and they get infected that way. So wash your hands frequently, rest, okay? Eat a balanced diet, drink plenty of water to hydrate yourself. Your kidneys will need that, so stay very well hydrated. And the medication will need you to get hydrated as well to help to eliminate out of your body. Make sure that you finish or you complete the course of antibiotics prescribed by your doctors. It is important that you don't take it for 2-3 days, you feel good, and then you stop taking antibiotics. Because what happened is you would kill off the weaker bacteria after you're taking the antibiotics for 2-3 days, and then you stop. You would leave the stronger bacteria behind, and they would multiply, and you would get sicker the second time around. That will need a higher dose and a different, higher, stronger antibiotic. So make sure that you complete your course of antibiotics prescribed. Okay? Now, people often ask me, how long am I going to cough? How long is this cough going to stay with me? You have to understand that the cough in a pneumonia can last up to 68 weeks. Now, does this mean you're going to cough your brain out for 2 months? No. Your cough will better as the infection and the inflammation is treated and subsided. But because pneumonia is such a big insult to the lung tissue, it is not going to recover overnight. It is not going to go away after 2, 3, 4 days or even 2, 3 weeks because you are treated with antibiotics. It is not unusual for people to get antibiotics and to finish it, they get better, and they're still coughing for another month or 2. Now, that is not an indication to get a second round of antibiotics. And this is a major problem because patients would finish antibiotics, they get better, that cough wouldn't go away within 2, 3, 4 weeks. They go back to the clinic and they ask for a second round of antibiotics. You are not failing treatment because the cough hasn't disappeared, okay? Unless you become hypoxic, unless your sputum production increase, unless you have problem breathing, unless you get more chest pain when you cough, the symptoms are worsened more than just a cough persisting, then you'll be considered failure of treatment. So it's important to keep in mind that a cough lasts several weeks after the antibiotics are given. Now, sometimes your doctors may repeat the chest x-ray about 6 to 8 weeks after to assure that your pneumonia is resolved. Now, we do that for people who keep getting pneumonia because we want to make sure that the pneumonia is not recurring in the same anatomical location in the lungs, which can indicate obstruction of that anatomical location. And that can indicate either cancer or some form of anatomical pathologies or some form of other diseases that can happen in the same area over and over again. And that can hinder the secretion's clearance, or it makes your clearance of the secretion much less. And that's why people keep getting pneumonia. So last but not least, there is a vaccine available for pneumonia. Currently, we have the Brevnar 13 and we have a Pneumovax 23. And it is indicated for people who are 65 and above, and they usually get the Pneumovax 23, and then a year later or 12 months later, they get the Brevnar. Now, you don't have to wait until you're 65 if you have significant comorbidities, meaning if you're asthmatic, if you have COPD, if you have diabetes, if you have cardiac issues, if you have HIV infections, or any type of autoimmune diseases that can lower your ability to fight the pneumococcal or the strep pneumonia bacteria. So make sure that you do qualify for this vaccine and make sure to ask your doctors for this vaccine. These are the brief information on pneumonia. I hope you find them helpful, and please subscribe and share. And as always, thank you very much for watching, and I'll see you again in the next topic or the next video.